Good afternoon, and welcome to the NIMHD Loan Repayment Program Technical Assistance Webinar. This is Dr. Dorothy Castile, and joining me are Dr. Addie Rosario, Tom Bolberg, Marlene Laud-Sharp, Shinley Nan, Richard Palmer, Deborah Ismond, Erica Boone, Andrew Chasek. We're going to start today by talking a little bit about the legislative history of the Loan Repayment Program, because it sets the stage for the changes that are taking place this year in the program. The initial loan repayment program began in 1988 with support for scholars who were conducting AIDS research, and under Public Law 100-607. This program was intramural only, and it was followed in 1993 by an expansion of the program to a general LRP for intramural scholars at the NIH, as well as to an intramural and extramural scholar program for clinical researchers from disadvantaged backgrounds, an intramural and extramural loan repayment program for clinical researchers from disadvantaged backgrounds, and an extramural program for researchers conducting research in contraception, and infertility, and followed by an extramural program only focused on contraception and infertility. This expansion was under Public Law 103-43, and it was followed in 2000 by Public Law 106-3-310 and -525 and 505, which authorized the development of 3 extramural programs. One focused on pediatric research, another focused on clinical research, and finally a program focused on health disparities research, all of those for the extramural scholars. In 2016, the 21st Century Cures Act was passed that provided a section expanding the ability of the director of the National Institutes of Health to make changes to the loan repayment programs that are hosted by the NIH. One of the authorizations that was given to the director of the NIH was to consolidate all of the loan repayment programs into 2 main programs. That is the extramural loan repayment program and the intramural loan repayment program. Within those 2 broad categories, the subcategories of loan repayment of programs were retained, but now there was an opportunity for the director to establish or eliminate one or more subcategories and to establish programs that would reflect workforce or scientific needs. In addition to this, the authority was given for the loan repayment award to be increased from a maximum of $35,000 per year to a maximum of $50,000 per year. And this corresponds with the increasing level of educational debt that we found our scholars to be laboring under. The recommendations constructed by the implementation panel were presented to the NIH director for consideration in early 2019, and this is the beginning of the implementation for fiscal year 2020. As it stands now, there are 5 extramural loan repayment programs. The loan repayment program for contraception and infertility research, for pediatric research, for clinical research, and the L32 for clinical researchers from disadvantaged backgrounds. At this time, this program is solely supported by the National Institute on Minority Health and Health Disparities. And finally, the loan repayment program for health disparities research, which now has an expanded ability to be funded by all institutes or centers at the NIH. The National Institute on Minority Health and Health Disparities envisions an America in which all populations have an equal opportunity to live long, healthy, happy, and productive lives. And we do this through a mission that leads scientific research to improve minority health and eliminate health disparities. We support research in minority health and health disparities, and those health disparity populations are identified as racial ethnic minorities, such as American Indian Alaska Natives, African Americans, Hispanic Latinos, Asians, and in addition to that, rural and underserved populations, people coming from low socioeconomic statuses, and sexual gender minorities. We support research to understand the causes of and to reduce health disparities. And we translate and disseminate research and foster collaborations, and given on this slide are some of the programs that we participate in. In addition to that, we supported the training of a diverse scientific workforce through the Health Disparities Research Institute, through summer internships, diversity supplements, and through other mechanisms. And the link at the bottom of the page gives you access to the active funding announcements supported by NIMHD. We're next going to talk about the eligibility of proposed research. And we're going to start by focusing on the main purpose of both of the programs. In fact, all of the programs at the NIH is to recruit and retain qualified health professionals as research investigators to careers in research, specifically careers in NIH-funded research. The two programs that we will focus on in this technical assistance webinar are the two that have been primarily supported by NIMHD historically and will continue to be supported into the future. The first is the L32, the clinical research for individuals from disadvantaged backgrounds, and then the second is the Extramural Loan Repayment Program for Health Disparities Research. To begin with, let's consider the definition of clinical research. At the heart of clinical research by the NIH definition is the need for contact with human beings. Research conducted with human beings can be either epidemiologic, behavioral, outcomes research, health services research, or concern new technologies and interventions. We look specifically at material of human origin that is directly collected by a principal investigator or colleagues. That could be tissues or cognitive data or whatever. Please note, this is very important, tissue samples that come from biobanks for which the PI or a close colleague was not a collector is inadmissible for this research. It's ineligible. The setting doesn't matter. It can be either an inpatient or an outpatient setting, but the main determinant is that the applicant must come from a disadvantaged background. That is a status and socioeconomic status that's established for the family and the applicant at the time that the debt was accrued. And this determination, this level of screening, is done by the Division of Loan Repayment. The second program that we're talking about is the research eligibility for minority health or health disparities research. And this is research focused on, as it says here, minority health or health disparities. And in every part of the application, we're looking for a demonstration of a commitment, at least for those who are coming to NIMHD, to health disparities research in every aspect of your career, what you've done in the past, what you're doing now, what you plan to do in the future. So here are some tips to kind of guide your thinking about that. Your current research must explicitly be focused on health disparities. That is, why is it that some groups have different mortality rates or morbidity rates in different diseases than other racial, ethnic, or socioeconomic status groups? What is the mechanism behind that? What causes that? And what can be done about it? Interventions to address those things. Second, you need to highlight previous health disparities research that you've been engaged in. This can be done in your bio sketch, it can be done in your personal statement, but it should also be done in your research statement and in your mentor's letters. Third, you should clearly delineate your next steps for future research linked with your career next steps. So you're arguing on two levels. You're arguing on your career development level, as well as the level of development of the science. What are you doing to develop your scientific questions? And then how are you going to do that with the career path and the career development steps you're taking? Finally, tell your story. Talk about how you're going to come out from under your mentor's umbrella and showcase your own pathway to growth as an independent investigator. This is a very important step, and it's something that your reviewers are going to be looking for. Just to be very clear about the health disparity research definitions, this is something that will hold for all institutes and centers that are supporting the Health Disparities Loan Repayment Program. We will talk about in a few minutes some cases that will help you distinguish between who you should submit to. But again, this information on this slide defines health disparities research as basic clinical, social, or behavioral research on health disparity populations, including individuals and communities of such populations, that relates to health disparities, including the causes and methods to prevent, diagnose, or treat such disparities. The populations are defined by law under the direction and determined by the director of NIMHD after consultation with the director of the Agency for Healthcare Research and Quality. And these are populations where there is a significant disparity in the overall rate of disease incidence, prevalence, morbidity, mortality, or survival rates in the population as compared to the health status of the general population. Please be aware that the health disparity populations are legally defined and cannot be changed at the whim of an investigator. Minority health research includes basic clinical or behavioral research on minority health conditions, that is, including research relevant to prevention, diagnosis, and treatment of such conditions. An example would be sickle cell disease or triple-negative breast cancer. Minority health conditions are those conditions, diseases, disorders, including mental health and substance abuse, that are unique to, more serious, or more prevalent in members of minority groups, racial or ethnic minority groups, for which the medical risk or types of medical interventions may be different for members of minority groups, or for which it is unknown whether such factors or types are different for such individuals, or research involving such populations as subjects or data on individuals is insufficient. So the big question this year, because other ICs have signed on to the Health Disparities Loan Repayment Program, is how do you know what institute or center to apply to, or to say that they might be interested in what you're doing? First, you need to understand that work that focuses on health disparities resulting from being either a member of a racial or ethnic minority group, or rural or underserved population, or sexual gender minority, and addressing underlying processes that produce those disparities is something that would be of primary interest to NIMHD. But all ICs at the NIH are required to support health disparities research. So work that focuses on the disease processes, the life cycle stage, the body system in a health disparity or minority population may also be of interest to them, and may be actually of more interest to them and more appropriate to them depending on the focus. So you really need to speak with program officers from the various ICs who will be appropriate for your application. The decision is yours in how to target your application. And we're going to talk now about a couple of case examples that will help to clarify, I hope, some of this for you. The first comes from an email that we received this year and states, I submitted a mentored research application last year for the 2019 funding, which was not funded. But I would like to submit again this November. My research focuses on health disparities related to African American youth engaged in substance use. In addition, as a developmental psychologist, I take a lifespan approach by considering the transmission of underlying processes of coping from parents to youth. Coping with discrimination experiences is the primary focus. This application, if it's focused at health disparities and elimination of health disparities in African American youth, may come to us regardless of what the disease outcome or the life cycle stage is. We are disease agnostic and interested in all stages in the life cycle. However, as someone who is trying to find support for your research, you should be looking at anyone who would be interested in your research. And in addition to NIMHD, the National Institute of Drug Abuse or the National Institute of Alcoholism and Alcohol Abuse may also be interested in this because of the substance use issue. In addition, because of the lifespan and the focus on youth, the National Institute of Child Health and Human Development may also be interested. The decision is yours. You need to call a program officer. My research examines, in the next example, the impact of nursing resources on maternal outcomes and the racial disparities of those outcomes. Research indicates that one explanation for racial disparities in maternal outcomes is varying quality of care in minority versus white serving hospitals. Differences in nursing resources across those hospitals may be one of the underlying factors explaining the disparities in outcomes, and also offers a target amenable to intervention. So intervention research, especially health services research of this nature that seeks to eliminate racial disparities in health outcomes, is certainly of interest to us. However, this would also be a project of interest to NINR, the National Institute of Nursing Research, and the National Institute on Child Health and Human Development, as it also focuses on maternal health outcomes. Several other examples, and we'll go through these very quickly, is research focused on identifying psychosocial factors, specifically perceived stress and social support influences that have an impact on the relationship between poor health status, high blood pressure, hypertension, and cognition, and how stress and coping impact blood pressure and cognition among aging African American and Latino populations. Well, this particular interest could be of interest to many areas. You could be of interest to mental health, for example, to the Institute on Heart, Lung, and Blood. It could also be of interest to the National Institute on Aging, because it looks at aging African American and Latino populations. The next example, my research focuses on anxiety and misdiagnosed hypertension in the clinic and racial ethnic disparities. In addition to NIMHD, this would hold interest for the National Institute of Mental Health as well as the National Institute of Heart, Lung, and Blood. My research focuses on health inequities, specifically substance use among Native American college students and substance use HIV prevention. We will utilize two programs targeting these populations to target collegiate alcohol and other drug use through a brief cognitive behavioral motivational individual intervention. This particular, in addition to NIMHD, this particular project could also be interesting to the National Institute of Allergies and Infectious Disease for the HIV prevention issues, to NIDA for drug abuse and NIAAA for alcoholism, as well as the National Institute on Mental Health. The final example that I have focuses on community partnership for preventing health risks among urban Hispanic young adults, and it aims to provide a solid foundation for delivering sustainable, high-quality, easily accessible HIV/AIDS and viral hepatitis prevention research and services to these populations. And this, again, would be of interest. In addition to child health and human development, as well as NIMHD, it would be of interest to NIAID. The bottom line is consider in marketing your ideas as you would be marketing a grant, although this is a contract, to consider anyone who would be interested in supporting your project. We're now going to turn to general eligibility, and I'm going to turn this part of the presentation over to Dr. Erica Boone and Mr. Andrew Chosek.
Hello everyone, my name is Erica Boone. I'm the Director for the Division of Loan Repayment. Thank you all for having me here today. We want to spend a little bit of time talking about general eligibility for the Loan Repayment Program. So Before we get into eligibility, I just want to update participants on two different important updates for the loan repayment program that starts September 1, 2019. So these are relevant for you right now. The first, if you have not heard, I don't know what rock you have been living under, but the LRP maximum award amount has been increased from $35,000 per year to up to $50,000 per year. Of course, the amount that is received will depend on awardee debt level. Call the LRP Help Desk for more information. There's also a debt calculator on our website, so you can easily get an idea or a guesstimation for how much you would possibly be able to receive. The next, and as Dr. Castillo has already addressed, is that the Health Disparities Research LRP participation amongst the NIH ICs has been expanded. Now, this begins September 2019. So all NIH institutes and centers now participate in Health Disparities Research LRP. In previous years, it was only administered and funded by NIMHD. So this is very good for HD applicants. Instead of just having one shot at the apple, now there can potentially be two. So make sure that when you're making a selection within the LRP application, that you really kind of pay attention and give some thought to whom you would like to review your application. And to make that easier, you all can check out the Contact and Engage portion of our website, where you can see all of the NIH ICs that participate within the LRPs. And also, you will be able to see the mission and the priorities for those institutes, as well as contact information for program officers. So now let's get into LRP eligibility criteria. The first is that you must have your doctoral level degree. So you must have your MD, your Ph.D., or as I say, one of the D's in between. There is an exception for the contraception and infertility research LRP, where individuals can come from a more allied health background. So you don't have to have a doctoral degree in those instances, but that's only for contraception and infertility. Next, regarding citizenship, you must be a U.S. citizen or a permanent resident. You must be able to commit to performing at least 20 hours of research time per week for the entirety of your LRP contract. First contracts are for 2 years. Individuals are eligible to apply for and receive renewals on their LRP contracts. They're usually for 1 year, but for the entire time of your contract, you must be able to perform research for at least 20 hours per week. Educational loan debt. So an applicant, or rather awardee's educational loan debt, must be at least 20% of their annual base salary. Lastly, but very important, regarding research funding. Your research funding and your salary support must come from a domestic, nonprofit university or government organization. While you do not have to have an NIH grant to be able to apply for and receive an LRP, your research must be supported in some way or fashion by a domestic nonprofit entity. For-profit research support in the form of salary or research support is not allowable. Again, call and talk to someone at the LRP Help Desk or Information Center to get more information. So what are qualifying loans? NIH will consider repayment of educational loans from your undergraduate degree to the time that you apply for your LRP. So the very expensive undergrad university that you went to, those loans are absolutely eligible. We also will repay educational loans that are backed by the U.S. government and educational loans from accredited U.S. academic institutions and commercial lenders. NIH will not repay non-educational loans, so no home equity loans. The new Tesla that I would love to have, you cannot go out and buy one of those on the money that you receive from the loan repayment program. Plus loans to parents. It's a big want for me because I have a college-age kid, but those loans are not eligible for repayment. Also not eligible for repayment are loans from non-U.S. governments or institutions. If you have a service obligation, for example, from a T-32, then you would need to call and contact the Information Center, because you would have to defer the service obligation for the other award when you receive your LRP. Also, loans that are consolidated with another individual, your spouse or your child, are not eligible for repayment. So before you do that, call and talk to the LRP Information Center. Also, if you're considered to be a full-time federal government employee or a VA fellow on a 5/8 appointment or above a 4/8 appointment, then please call us, because you may be ineligible to apply. This slide is a little bit busy, but there are a few things on the slide that I want to really call your attention to. The first thing is that I want to call your attention to the fact that our three largest programs for the LRPs are the clinical, pediatric, and health disparities research LRPs. Also, as you can see, our success rate is approximately 50% across all of the NIH ICs. So that means that some are lower and some are much higher, but overall, the success rate for the program is about 50%, and that's better than any success rate you're going to see at NIH. As well, we distribute approximately $68 million each year in student loan repayment. Actually, this past year in 2019, I think it was $72 million that was distributed. So why am I telling you this? Because there's a lot of money up for grabs, and we distribute it every single year, and you will never ever be in the game if you don't play. So that means you need to review information on our website, call the information center, as well as make contact with the program officer that knows about the loan repayment program so that you can be eligible. So now let's take a look at an applicant snapshot from 2018. So the average age of our LRP, actually awardee, is about 37 years of age, and their average award is about $56,000. Now for those of us who can add and subtract in the room, that $56,000 is more than $35,000, but if we take into account the taxes that we also pay on behalf of an LRP awardee, that's where we get that $56,000 average award. Average debt of our new awardees is about $150,000. So, or 65% of individuals had debt up to $150,000. Of course, that can be more than that. And as a matter of fact, I talk with early stage investigators all the time whose debt is well over that. So now if we take a look at applications versus awards by gender. So in 2018, the success rate for male awardees was a little bit better than females, but that percentage tends to move from year to year. Last year it was exactly 50%, and now for 2019 or 2020, we're hoping that that percentage rate will be probably about even again. So applications versus awards by degree. Now, while we have our lowest number of applications and awards from our MD, PhD population, their success rate is a lot higher than that of our MD and our PhD applicants. But the success rates are pretty good. All right. So now we've talked a little bit about general information about the loan repayment programs. So why would you want to apply? There are several career-related advancements related to the LRPs beyond just receiving the up to $50,000 amount. So what we did is that we did an analysis or performed an analysis of the loan repayment program awardees. That's you guys out there in the audience. And what we did is that we compared individuals who applied for an LRP and received an LRP versus those who did not receive an LRP. And we developed a measure which we entitled retention and research. So what does that mean? It means, are people staying in research careers for longer periods of time, and are they also engaging in scholarly activities such as writing grants, receiving grants, publishing in journals, so on and so forth. And what we found overall is that amongst the funded group, 68% in fact, there was a much higher level or demonstration of retention and research as compared to individuals who were not funded or who did not receive an LRP. So this is overall. But if we break this out across years, and we look at annual persistence and research. So for this analysis, we followed people over several years, actually for 14 years after they received that LRP. And what we found is that those individuals who were funded versus those who were not, exhibited, once again, much higher levels of persistence and research that really took off from the time that they received that award until up to 14 years later. So when your PI or your mentor asks you, why are you applying for an LRP award when it's not giving you any kind of research support? You pull out the slide and you show it to them. We also took some time to actually ask awardees about their direct and personal related benefits of receiving an LRP. And of course, the number one is some relief from the tremendous debt burden of student loan debt. I don't have to tell you all about that. It's really a concerning factor for many individuals that are starting out early in their career and can really be an important decision point for them or which pathway that they pursue. Staying in a research career that they love that may not pay as much, or going into perhaps another career route that would pay them a lot more money but might not be as gratifying. The next one is the ability to pursue career-related passions without as much worry about salary. Now, while we're all worried about our salary, initially this may take some of that financial pressure off. Also, an important one, especially for clinicians, is protected research time. When you receive an award, representatives from your institution must sign something must sign a document that indicates that you have protected research time. Because if you don't have that time to put into the development of your research career, how will you ever be able to reach independence? The next is practice and preparation for applying for other NIH grant mechanisms. If you take a look at the LRP application, the format itself is very much like a K or career development award application. As a matter of fact, I'll call the LRP application either a grown-up F or a mini K. The next one is an added boost to career preparedness and increased productivity across the career. You saw that yourself with the graphics that I explained, or that I just showed to you. Also, the ego boost that you need to show yourself that you can do this. I'm pretty sure that you guys talk to investigators all the time that tell you all about how hard it is to sustain your research career and about the grants that they did not receive and the number that they applied for. And that's kind of a tough environment to exist in. But receiving this LRP at an early career decision point in your life where you're really vulnerable to leaving research is kind of the ego boost that you really, really need to show yourself, to show your PI that you're engaged in an area of research that NIH considers to be high priority and you are fundable. So now let's take a little time to review the extramural LRP application cycle timeline. So as you can see on the far left, for the score on the far left, the application cycle is open between September 1 to November 15 of every single year. Your application plus all of your colleague and supporting documentation from your recommenders and your IBO, your institutional business official, are all due on or before November the 15th. I will take a little detour right here and explain that over half of LRP applications are submitted on November the 15th. And let me tell you, if there's going to be anything that goes wrong with your application, or if you're having any problem with your letters of recommendation or anything like that, it's going to happen on November the 15th. It also means that there are going to be approximately 26,000 people that are going to try to interact with my LRP system on that particular day. Do you want to be number 26,000? No, you don't. So prevent all of the anxiety that's going to occur by submitting on the last day by trying to submit well in advance. I do know that that can be a pretty difficult thing to do, but please do not wait until the last minute to submit your LRP application. Applications will undergo peer review between February and May. We will also verify your applicant, or will verify the applicant loaned information between May and June. We call that loan documentation, or loan vetting rather, loan documentation vetting. Final funding decisions are made by early August, and your lender, not you, your lender, like the Sallie Mae, so on and so forth, will receive your first payments by like November. Please remember that quarterly verifications of your service, research and service, are due 4 times a year, and you're going to have to log into your portals to make sure that you are verifying your service and that your supervisors are also verifying your service. Just a reminder that you can apply online by 8 p.m. Eastern Standard Time by November the 15th of this particular year. If you are submitting on November the 16th, and you're just going to be early for the 2021 application cycle. So why don't we just make sure that we apply early. Application updates. We're going to hand this over to Andrew Chausick.
Good afternoon to all you folks out there in webinar land. Thank you for joining us this afternoon. And I just wanted to provide you very quickly with some updates for the 2019 LRP application for fiscal year 2020. The good news is that there are actually no major updates to the application itself. So if you've filled out an LRP application, completed an LRP application within the last couple of years, it's going to look very, very similar, if not the same, for all intents and purposes. If you've never completed an LRP application in the past, we strongly urge you to reach out to our LRP web page, www.lrp.nih.gov, and download our application guide. The application guide has recently just been updated, and any major information that you need to know will always be included in that bulletin, and it will also serve as a very good roadmap to help you complete the application from start to finish. Even if you have done an application in the past, it's still a good idea to download the application guide and read through it, because there's some useful information and tips that you'll find included with it. Also of importance is to make sure that your Commons ID password is current. You will not be able to submit your LRP application if you do not have a Commons ID. Most individuals at this stage do in fact have a Commons ID, so your homework really just means that you need to make sure your password is up to date. If you do not have a Commons ID, it is vital that you go through and start that process of obtaining one today. It can take up to 6 weeks to get a Commons ID, so it's critical that you start going down that path now. If you don't know how to obtain a Commons ID, it's in your best bet to contact your grants office at your university or research institute. One of the grant officials there should be able to help you out and get that process started. We've spoken a lot already about the expansion of the Health Disparities LRP effective this year. When you are completing this application this year, you're going to have a choice of which IC can review your LRP application. In the past, it was always restricted to NIMHD. This year, you'll be able to choose any of the 24 participating ICs. It is a choice, it's a preference. It's also important to note that every once in a while, your preference isn't honored as it goes through the review process, and it could go to a different IC. But generally speaking, 95% of the time, your preference will be honored. That all having been said, this is the first year that other ICs other than NIMHD are going to be reviewing LRP applications for the Health Disparity Program. It is critical, and we cannot stress this enough. You need to reach out to a program officer before you submit an LRP application to any other IC other than NIMHD. I would even say that if you're going to do so to NIMHD, it's still worth it for you to reach out to a program officer. But in particular, if you are submitting or indicate a preference for an IC other than NIMHD and you do not reach out to a program officer, the expectation that we have right now is that there's a very high likelihood your application will be withdrawn and deemed non-responsive. It is a lot of time and a lot of effort to put together a complete LRP application, only for you to find out that the application's withdrawn, non-responsive, sometime in February. You're going to be really disappointed. You can really avoid that situation if you simply reach out to a program officer. Once again, if you visit www.lrp.nih.gov and you go to the Contact and Engage section of our webpage, you will find a complete list of program officers, their names, telephone numbers, their email address, along with the mission and priority statements for each IC. We recommend that you reach out to program officers first by email and try to establish a mutually agreeable date and time for you to have a conversation so that you can really talk about your research and why you think that you should be applying firstly to the Health Disparities Program and to that particular IC. And that's going to take you a long way and really help out and make sure that your application is accepted by the IC once you've submitted it. Also, you'll notice too, as you're navigating through the LRP application this year, on a couple of the tabs at the top in big red font, it reads, there is, you're not permitted to receive any type of for-profit support. This is something that has been in the LRP regulations since 2013, so this isn't necessarily new, and in fact this is old information, but we're trying to do a better job of making sure that applicants are aware of this important piece of information and that it's communicated to you in a way that's very clear. What that means is this: LRP applicants are not permitted to receive any salary support or any research funding support from a for-profit source. So that would include pharma money, which is most commonly what we see individuals receiving beyond any nonprofit support. So once again, you need to be employed by a domestic nonprofit research organization, institute, or university. And additionally, your research funding, wherever those dollars that are supporting your research, wherever those monies are coming from, they cannot be coming from a for-profit source. Other than that, as stated, there are no major updates to the application for this particular application cycle. In the meantime, if you have any questions, concerns about the application, you can always reach the LRP Information Center. We are available Monday through Friday from 9 o'clock a.m. until 5 o'clock p.m. And then on the deadline day, we are available until 8 o'clock p.m. Eastern Time. And our information is available again on our website, where you can get our email address, our telephone numbers, etc. Also, be sure to read through our website, and as already stressed, please read our LRP application guide. Have a wonderful afternoon.
Good afternoon. I'm Marlene Lothrop. I'm speaking on behalf of the review group that will be in charge of the review of your application. First, so the LRP application are reviewed by external reviewers, and they are going to look at where you are now, where you're going, and what kind of what kind of research you are doing, and at which level of the that you're doing it. Are you the PI? Are you just a co-pilot? And what are your plans for the future, and what is the timeline? The application have major sections. They have the research activities section, which is a big part of the application. First, the personal statement. I like the previous training, development of scientific interest, accomplishment, short and long-term career goals. The second part is the training and career development plan, which emphasize on skills acquired along your path to independence. So again, training, professional and leadership development opportunity, grantmanship, workshop, conference attendance, etc. And it's good to include what you did or what you're going to do in the next 2 years. The third part of the research activity is the proposed research plan. So plan the research activity. So the specific role, like I said earlier, what is your specific role in that research activity, your responsibility, also include the 2-year timeline. The second big part of the application is the research environment, why are you where you are, who or what is important there at the institution where you are. The third part is the loan information that is for new applicants only. And so lender and servicer information, loan number, total loan amount, loan status, c'est-à-dire it's in repayment or forbearance.
I'd like to make a small note here. I just want to make sure that applicants understand that your loan information is not a part of the application that the reviewer sees. Reviewers never see your loan amount. So, and also don't think that that portion of your application is under review. As a matter of fact, applicants often think that the lesser amount of loan debt that they have or educational loan debt they have, it makes them look like a better applicant. It does not. It's in your best interest to make sure that you include all of your educational loan debt so that you can receive maximal loan repayment on that.
Thank you, Erica. This slide is about the major section of the application and not directly on what the reviewer have to look at. So that third part will not be seen by the reviewers. Sorry. So what are the reviewer going to look for? They going to evaluate the applicant potential to succeed in a research career by rating several items. So the applicant previous training and research experience, the applicant's commitment to a research career, the strengths and quality of the letter of recommendation, the quality and appropriateness of the research environment, and the research progress for the renewal application only. So they will also look at the likelihood that the applicant will continue in a career focused on research. They will look at if the previous training of the applicant is appropriate, and also if the applicant is experienced to prepare for a research career. They will look at the appropriateness of the proposed research activity during the next 2 years of the loan repayment award period, and that will foster a career in research. They will again also look at the commitment to a research career as reflected by the personal statement of long-term career goal and plan to achieve those goals. One of the things that is very important is, and they look at it very seriously, is the strengths of the reference letters, also called recommendation letters, and recommendation that will attest of the applicant potential for a successful career in research. They are going also to look at the quality of the overall environment to prepare the applicant for a research career. So the mentors, they're going to look at the mentors' records in mentoring researcher, their funding history, and their research productivity. They are going to look at the quality and availability of appropriate scientific mentor and colleague. And they are going to look at the quality and appropriateness of the institutional and resource and facilities. For a renewal applicant, they look carefully at the applicant research accomplishment during the previous loan repayment support period. And they also assess the applicant development as an independent investigator. And this slide is to give you some contact that you can need, the Division of Loan Repayment that you can contact at any time, the program officers that you can contact until November 15, 2019. You will get the feedback later on in July 2020 or later. And a scientific review officer, you can contact between November 16, just the day after the last submissions day, so November 2016, 2019, until May 1st, 2020. Thank you.
So thank you, Marlene. And now just to do a quick recap of additional information that may be helpful to you. One of the things that we know is from the time that you submit your application, November 15th, to the time that you learn about an award or the lack of an award, many things can happen. And some of those things might be that you had a publication accepted or a grant application, that you had submitted a K award or an R of some kind was submitted and funded, that you've had a change of institution or a change of research, change of mentor, or some other kind of life experience, life emergency. And there may even be a change of employment. Any changes that take place between November 15th and January 30th, talk to your program officer and the Division of Loan Repayment. After January 30th, starting February 1st, no changes can be made to the application because it is under review. If you have any of these experiences, please call your program officer. Just to make sure that we have you hot linked into everything that you could possibly need, these are some links to both the Division of Loan Repayments frequently asked questions and those FAQs coming mostly to NIMHD, the most recent funding announcements, and the application instructions. And here is our contact information. Thank you for joining us. We're going to now open this up for questions, and I'm going to turn it over to Dr. Adi Rosario. Adi?
So we're going to try to recuperate some time and quickly go through some that we already have been posed. So to Dr. Castillo, regarding mentored versus status of independence, there's a funky space where they have not yet put in an R level grant, but meet most of the criteria in that A through Z checklist. What to do?
For the most part, if you have not received funding, whether from NIH or another institute, of at least $100,000 per year with you as the principal investigator, even though you're in a tenured position, not tenure track, but you've already achieved tenure, even though you have funding from your institution, you're not considered independent in the eyes of the NIH and really need a mentorship team. I would contend that you need a mentorship team throughout your career, but it's a requirement for the loan repayment program in this set at this time period.
So someone who already has a research career well established, but is not yet in the sphere of health, is this a good time for them to apply for an LRP?
They're going to need to, there's going to be a huge lift for someone who's not in the health career to apply for a Health Disparities Loan Repayment Program. And I would say that you may want to find some other pathway to get your loans repaid. You're going to need to show some kind of a track record of what you've done, what you're doing now, what you plan to do to become an independent health disparities researcher, for your career, how you're going to get funded. You're going to need publications and all kinds of other documentation, including mentors who are going to independently describe in detail how they know you and what they know of your career development pattern and how you will be a health disparities researcher. If you have not done that, the likelihood of your getting funded is quite slim. I'm going to refer this also to Dr. Erica Boone to see if she has anything to add on that topic.
No, you covered it.
In regards to any kind of log-on difficulties or issues, go ahead and contact directly ERA Help Desk, because there could have been issues with someone applying in the past or having initially established some kind of an account a few years back, and there could pose a difficulty in a more contemporary attempt to put in an application. Andrew, you have some comments?
Yeah, if you're having any log-on problems, definitely your first step is to get in touch with the ERA Help Desk. 9 times out of 10, the issue is that your Commons ID has password has expired. That's almost always the issue. So once you get your Commons ID reset, you should be able to log in without difficulty. If you have reset your password password and you're certain you've reset your password and you're certain you're using the proper reset password and you're still having difficulty logging onto your system, you can also reach out to the Information Center at the Division of Loan Repayment. You can give us a call at 866-849-4047.
This is another reason for why you should try to log in and access your account early as opposed to waiting to November the 14th or November the 15th. Just don't start in November. Start in October if that's going to be the latest that you're going to do it. Make sure that you start early because this can actually pose a real significant problem for you.
So someone who has already received an LRP earlier in their trajectory, postdoc, for instance, and has transitioned to a recipient of a K-99 RU and is on a tenure track position, or even possibly have advanced to tenure position, are they still eligible for LRP?
Yes, you're eligible for the LRP throughout your career. The tendency, as Dr. Boone can attest, is that the loan repayment program is mostly applied for by younger scholars. However, that you're not ineligible at any phase of your career development, and whether you've been funded or not does not affect your eligibility. And for the most part, it may not affect your getting funded. You may want to check with the admission of the institutes that you're applying for about whether or not they're going to select somebody who's a young career, an early stage, or a later career. But for NIMHD, it doesn't have an impact. What has an impact is how you have conducted your career, if you have gotten NIH funding, and if you've published on your fundings and you've been a productive scholar.
Just make sure that if it's 37 months since the last time, or greater than 37 months since the last time you received an LRP, you still have to satisfy all of the eligibility criteria, including the educational debt to income ratio.
So earlier in the presentation, we did have clarification with what constitutes health disparities group. We've got the racial and ethnic minorities, low SES, rural, and SGM. So if you're doing research, for instance, on incarcerated individuals, that would fall under the low SES disadvantaged population, which is a health disparity population and does qualify for applications to come our way, just to clarify.
But that can also satisfy the clinical research LRP as well. So for example, all of my examples always come from substance abuse and addiction because that's the kind of research I used to do. So for example, that is a hot button area or a mission critical area at NIDA as well. So you want to call at least 2 program officers, you want to establish contact with at least 2 program officers that are listed on the LRP website. You want to gauge enthusiasm for your research with regards to funding from that institute. You want to make sure that your research is under their funding priority as well as their research priority because they're not the same thing. So you might want to check.
So again, always call your program officials. Contact.
Email first.
Establish contact. I like
yes,
the verbiage
contact.
that you all
Email
are
first,
using.
and then set a time to call because you want to make sure that you're, as I always say, your baby is in the right daycare. So for me, the type of research that I was performing, I could have applied to NIDA, I could have applied to NIAAA, I could have applied to NIMH. For me, I didn't even know about the loan repayment program. So I missed out on that one. But when I was applying for funding way back in the day, those were my 3 choices.
So in regards to the timeline, to reiterate, because it did get reviewed over the presentation, you need 2 years of dedicated time to the research from the start of the funding.
From the start of your contract. So really, if you're applying for an LRP for the first time, you kind of need 2.5 years worth of time because you're submitting your application in November. It's not going to get funded until July. So you would need to have 2 years of protected research time, funding for your projects, as well as salary from July 1, let's just say 2020, until June 30th, 2022. Is that right? Okay, thank you. Add and subtract. Okay.
So in regards to renewals, as everyone has kept saying, establish contact. So establish communication so that you can identify dates, times that we could actually have a discussion. So for the first time now, NIMHD is able to give feedback back in a way, which we have not prior. So yes, please reach out to us if you have had if you had put in a prior application and you need feedback because it did not reach funding. So Dottie, would you like to share what they can expect in regards to feedback this year?
So this year we've been working with Review to have Review prepare selected comments from the summary statements from the reviewers, and we're sending that out to people who are requesting feedback. This does not mean that there's an avenue for appeal for the decision. Funding decisions are made with a complex algorithm, some of the factors of which you have control over: the quality of your writing, the quality of your career development plan, the concreteness of your career development plan, the quality of your mentorship letters, that each one is detailed and shows knowledge of you as a scientist and your career trajectory in particular. Some things that are out of your control entirely: the amount of money we have in the budget, the number of people apply, and such things as that. So you can expect, if you send in a request for information, that it's going to take us a couple of days. We've been going through things and working on this list, and there are quite a number of people that we're still working on, but we did get out on Friday our first little bundle of responses, and people have been very positively responding to that. So be patient. We're going to try to get information out as fast as we can, and we have a huge thank you to Dr. Marilyn Lodge-Sharp for that.
This is Erica Boone. I'd like to add one more thing. It constantly amazes me when I speak to early stage investigators, the number of individuals who did not speak with the program officer prior to the application or following the application. And you have applied multiple times and you've never spoken to anyone with regards to your application. That is not the most efficient way in order to conduct this process, because you have no idea of what areas of your application you should be addressing with your subsequent application. Applying for an LRP award is just like applying for anything else here at NIH. The same exact thing. We're not giving out scholarships to, Disneyland. It's the same exact process. It needs to be taken seriously, as well as any other mechanism. You'd never apply for anything else without having contacted a program officer. It's the same exact thing for the loan repayment program. Please reach out to someone. It doesn't matter whether you've applied previously to NIMHD or a different institute. You have to have some sort of foundation from which to start to revise your application. And it is very important that you speak with someone so that you understand how you can improve elements of your application.
So when you contact either Dr. Castillo, myself, Vince, Mr. Thomas, whatever feedback we provide at that time is really the optimal and most feedback that we are able to provide. So what we ask of you is that please don't email me and ask for feedback from me and then think that in 2 days when you contact Dr. Castillo or Dottie that you're going to get any kind of different feedback. It's kind of standardized what we are we do have parameters and boundaries on what we are allowed to share with you, and that is what we will be providing and sharing with you when you hear back from us. Another question that we've been receiving quite regularly this year, given that now the other institutes are going to be participating with in the L60, I know this was covered, but just to reiterate, if you have applied before to NIMHD for an L60, but this year you have a conversation with one of the other institutes and they indicate great enthusiasm over your concept and application and your what you'll be submitting, and you decide to go with that other institute, it will be going to them as a renewal.
Yes, that is true. And also please understand that when you're applying to health disparities for a different IC outside of NIMHD, it means that your focus may need to be a little bit different. This technical assistance webinar focuses on how to apply specifically for the Health Disparities Research LRP here at NIMHD. However, you may want to plan it a little bit differently because, as Dottie has said before, and Dottie, maybe you've already discussed this, but basically your aims may need to be formulated slightly different when you're applying to a different IC. For example, you want to focus more on the disease process itself if you're going to be applying to NCI.
Okay, so there is a question about, you contacted me, so this is Dottie, and you contacted me early in September, and you still haven't heard anything from me. I appreciate that. I appreciate that it's a slow process. Receiving written feedback is the same feedback that you would get if you would be talking with one of us. So please accept the written feedback that we're going to give you as the contact. For those of you who are new applicants and looking for new information, if there's some question that we have not answered in this webinar, please write to us first with the question, and then we'll try to get back to you. But we're trying to reach as many people as possible. And one of the things that didn't show in Erica's slides is that NIMHD receives more applications than all other institutes at NIH, including the National Cancer Institute, who has the largest budget. And so giving feedback is really, and talking to people who are new applicants is really an arduous, time-consuming task. And we try to do the best we can. If we're slow to respond to you, it's your job to just keep pinging us, honestly, and we'll do the best we can to talk with you. Are there any other questions? I'm not seeing any more coming across the line, and I don't think Dr. Rosario has any more either. In that case, we want to thank you on behalf of the Division of Loan Repayment, the Scientific Review Branch at the NIMHD, our technical staff, and our wonderful analyst, Leah Artiles, and Addie and Vince and myself. We'd like to thank you for your participation and wish you all the best of luck.
We also want to remind you once again that the Division of Loan Repayment will host an application technical webinar tomorrow, Tuesday, September the 24th at 3 p.m. Eastern Standard Time, and it will be recorded. Thank you.
And these resources that we mentioned will be posted on the website within about a week or so. Okay, thank you. Bye now.